I am excited when I see counties, and especially a county, Turkana County, doing a very, very, very good and exciting job, knowing their landscape and how expansive their county is. But you can see the good things that they are doing, reaching out for patients from their residence or where they are to prevent them, to take care of the most common communicable diseases. inSupply Health did undertake a survey in and supported the 4 counties. The results are exciting. It is my hope that this good work that has been done by the 4 counties can be replicated in the other 43 counties because of the biggest impact that it has on health of residents in those respective counties. Look at how easy it is to implement the CHVs, the volunteers, because we have thought all this time that we needed a trained personnel to reach out to communities. But now, here we have a volunteer. Even if you talked about a stipend, how much can you spend on that community health worker? The least that we can spend on the lowest kind of health worker is 25,000 going to 30,000 a month. And when you look at the impact vis-a-vis the input and the people they are reaching out, the impact is enormous. We needed to have done this yesterday, not today. Because partly why our country is going into disease outbreaks is because of some simple things that we can prevent at the local level. I am excited in the efficiency that this has brought up, and the mere fact that you don't have to rely on internet, which has made all of us very lazy. If you don't have internet, the first complaint that I had, there was no reliable internet, and it made so many people uncomfortable. Try and imagine what our CHVs are doing without use of internet. We have become slaves of things that we can do away with. And that innovation, this is what our country needs, because from the comfort of our offices, we think that we can only move things when we have internet. We need to move away from that. I feel that what inSupply Health has done, they have done a good job. We are coming in a little bit too late. We are not complaining. We are not accusing anyone of anything. Remember, those who have been following what has been happening, in the last 2 years, nobody knew about DHPT. We were a small unit relegated in a prefabricated part of Afia House. But then, over time, we needed to assert our position and on the relevance of health products and technologies, because you can't talk about a functional healthcare without talking about HPTs. And the uproar in our country is we don't have enough of HPTs. We are not budgeting for enough. Once the HPT supply chain is interrupted, like what happened in the KEMSA, you can hear the noise. Therefore, just reinforces the fact that HPTs plays an important role in our healthcare system. Therefore, when we did our strategy, and for those who have not received a copy of the strategy, we are going to make arrangement. You can liaise with me We are going to give you a copy for your file, a copy for your library. Even if you don't get it today, you can give me your mailing address. I'm going to mail it to you. Those who need a hard copy, those who need a soft copy, I'm going to provide. That gave us prominence and relevance. Therefore, we were upgraded from a unit to a division. And within less than a month, we also got upgraded from a division to a department. And we have the promise by the close of the year, we are going to be elevated into a directorate so that we address those issues related to HPTs. Therefore, inSupply Health, I am not complaining that sometimes even if you wanted to engage with us, you didn't know who to engage. But now, for any issues related to HPTs, we'll be at the center stage, and we will help you because we have a national strategy to implement any future project related to HPTs. The counties represented. It is very exciting to see what counties are doing, and especially counties like Samburu, Turkana, Mandera, and Wajir. Because you look at very many other counties, because we know what is happening, there are a lot of problems, real lot of problems. Sometimes a good act like what you are doing cannot take place because of a lot of infighting. Maintain the good work that you are doing. Remember, what you are doing it for Wajiko and the people of Kenya. If every county replicated what you are doing, then half of the problems that we have in our country would be addressed. Going into the future, we are planning to engage all the 47 counties, take you through the strategy so that you understand we are here to complement the good work that you are doing. Anytime you get stuck, don't hesitate giving us a call, paying us a visit. We probably could have solutions of some of the problems that you are encountering. I'm happy this is only a beginning of our engagement. We are going to engage further. When we call you, please turn up because there is a lot that we can do together. And with those few remarks and very many remarks, I declare this one-day meeting officially closed, but the engagement should continue. We are not closing the engagement. It's only the meeting, today's meeting. The engagement should continue. Let's continue talking to one another. Is that good? Thank you very much.